We here? Yeah.
All right, call the
Mr.
meeting
Neese
to order.
coming?
No.
First order of business, did we have public comment? I don't
No.
think so.
No, it's just a special meeting.
All right, the virus issue is the next.
So, a couple of things. One, I am personally still sorting through all of the emails and information that I've received from various agencies regarding what we can and cannot do and what we should and should not do. I met with Karen Rossi and the two chiefs at 9 o'clock this morning, just so that we could kind of get on the same page with all of our messaging, what we already knew, because we had all been in contact over the weekend. So they can certainly speak for themselves. But one of the questions, obviously, is whether with motor vehicle registrations. I understand that right now, if you have a new vehicle and you have to do it in person, is the state going to change anything about that right now? What can we do about that? And these are questions actually that the municipal managers are already putting out there to the various state agencies. So again, as this continues, we're just going to have to keep getting answers. But what came out of our meeting at 9 o'clock was that we are recommending that we, to the extent that we are able, again, we're still trying to figure this all out, shut our buildings down to outside visitors, let's just call them. So in other words, shut the buildings down to the public. Certainly in this building, we're recommending that we no longer allow people to have their meetings here, if in fact they haven't already decided for themselves that they're going to suspend their meetings or have them done remotely, or however they want to handle that, but that we think that we shouldn't let people use this building. One, because we obviously need to keep our safety personnel as safe as possible. And number two, I think that we have to be, as the town, sending the message out to the public that we are taking this seriously. We are paying attention to what the CDC is telling us to do. We are taking seriously what the state is telling us to do. In terms of my office, I've met with the custodial staff this morning and talked about what supplies they have, what supplies they might still need to get. And they are just going to become super diligent with wiping surfaces down with bleach, most likely, and just keep rotating through our buildings to make sure that we're keeping up with that. I have instructed all of the staff that reports directly to me, we're going to maintain the 6-foot difference. We're not joking with this. I mean, everybody knows, honestly, on Friday, I gotta be honest, I wasn't taking it that seriously, but everything that I read this weekend, and then especially the email that I read from my niece, who is a physician in New York City, convinced me that this is something we really need to take very seriously. I should have started out the meeting by saying that we are being recorded. Because I got, as soon as the notice went out that we were having this meeting this morning, I got a phone call from a resident who was asking us if we were going to be making it available via videotape. So there are certainly residents who are taking it seriously. I don't know, maybe Karen, whether you want to talk about what the schools are doing in 68 hours of hunger, and whoever is the best one to talk to that information.
Chief Dronsfield should talk on that one.
Because there's been, you know, and we have all been following the Facebook posts, there are a lot of people who are very concerned about now the kids aren't going to school, how are they going to get fed? The schools are taking care of that.
So I talked with Catherine Moore, the nurse at the Massway Schools. She's also one of the members of the N68-hour committee. They were actually in a meeting when I called her, discussing what they were going to do. So when the at-risk children were sent home on Friday, they were given enough food to carry them through till Thursday. Their plan is to, the teachers are still at school, just no students. The cafeteria is still going to be open, making breakfast and lunch. And they're going, starting Thursday, the children who get reduced or free lunch and the N68 students are going to be delivered meals via the buses. So the school buses will still be doing their routes, delivering meals to the kids. That's starting on Thursday. And we let them know, obviously, if they need any help with it, to just call us. And one thing that Julie did mention, and the reason why I think that our response is more amped up is obviously the number of cases doubled over the weekend. And all indications from the CDC, DHHS, it's gonna get worse before it gets better. So we need to be ahead of this, not only for the public, but to protect our employees. So I know for the police department, all non-emergency response, like unlocking car doors, unless they call and say my child's locked in the car, AAA can do that for you. VIN verifications, they can go to a mechanic and get that done. Those non-essential things, the non-emergency things that we do for people, we're gonna cut back on. When people come in to do sex offender registrations, it's gonna be done, they're gonna be out in the hall, they're not gonna be brought into the station like we normally do. You know, obviously, when we arrest people, that's, you know, we've still gotta do that, but minimize as much of the contact as that we have under our control. And as I stated in the email, I have one officer's significant other who actually was in contact with a nurse who has been tested positive. So she's quarantined, hence I told him to stay home. And I was told last night, he texted me, she developed a fever. She was brought in to be tested, so we got a couple of days before we know about that. My other officer who went out sick over the weekend just called me, allergies. So he'll be back. So that's where we stand right now. The other population we need to think about are the elderly, and we discussed that as well. Meals on Wheels, you know, they're still handling that as they normally would. After this meeting, we've discussed putting together a general press release stating this is what we're gonna do, this is how business is gonna be handled, and if people need our help, come to us and we'll help you as we can.
Yeah, I spoke with the director of Meals on Wheels last week. And, you know, so far they are still conducting business as usual. They're fielding an awful lot more phone calls. And, I mean, again, unfortunately, the state was talking about shutting down. They also feed a large number of people in a place, I think their facility in Dover maybe. And the state was
Yes.
talking about not letting them do that, so.
Chief, what's the backup plan if more officers become sick?
So I've been in contact with state police, specifically Troop A, Lieutenant Hennessy. We had a group email with the bordering chiefs, what if? And it's gonna be one of those things, if we're affected, we'll draw from Durham, Barrington, New Hampshire State Police will help come in and cover. You know, if we have to go to 12-hour shifts, we've done that before when we're seriously shorthanded. So we'll get through it one way or another, and that's where our mutual aid comes in.
Financially, how's your budget for that?
Right, well, I had Robin run it, I'm a little over 50, about 51% spent, so I think we'll be in okay shape. And, you know, a lot of my overtime, not a lot, but a percentage of my overtime budget that I've already spent is actually grant, so that money can actually come down if needed, so I think we'll be okay. Yeah, you know, if I'm covering shifts like I worked yesterday, that's not an overtime issue, so we'll do what we can to get through it.
Julie, if we have to, for emergency purposes, can we tap the unassigned fund balance because of this?
That's a question I would have to go to the state for.
Could you do that, please?
Yep.
Because right now, you're stable, I understand that, and fire department probably, and everybody else is stable, you're fine into the existing budgets, but there's a point, if this goes on and it gets really bad, we might have to find some more funding and.
Oh, talk about money, look who shows up.
Yeah,
And by the governor declaring it a state of emergency, we got a letter from our rep, our FEMA rep, that keep track of all your expenses, because some of this might be reimbursable.
Okay.
So that email came out on Sunday afternoon, keep track of everything, which we are.
right, although,
But it's unclear what though.
right,
Right.
it's unclear, and we listened to the phone call on Friday.
And there's another one. at
It's
noon.
clear as mud.
I mean, what's, yeah,
Thanks.
that's, right. What's
I think we left that conference call with more questions.
Right, so what is unclear is, okay, that's great, we'll keep track of, what are we keeping track of? So for example, if we order an employee to stay home because they've been exposed, is that money gonna be used to cover their salary? Or is that still coming out of our pockets?
And maybe we'll learn that at the noon call.
And maybe we'll learn that at the noon call today, but I don't know. I don't know.
I have the same questions for the chief. Our chief.
Chief Nemeth?
Yes. I'm looking at him. He moved for some reason.
The only thing I was gonna bring up for, when we have the winter storms, any overtime's covered by FEMA.
Fuel mileage.
So if we keep track of that, if it's their normal shift, then it doesn't get compensated, but if it's overtime, then we can get covered usually. So I'd assume this round we'd be the same.
Okay. You have enough coverage?
For us right now, we're running normal. We don't have any cases within the department as of right now. Probably after this meeting, I'm gonna implement, everybody takes their temperature when they come into work. I know, and I've been reaching out with McGregor, with Durham Fire, talking to a lot of the other departments. They've started to do that at the beginning of their shift, around lunchtime, and then before they leave, they take their temperature to make sure they don't have a fever. If they do, they get sent home, and then they can't come back for 48 hours after the fever subsided. So we're probably gonna implement that as well. We get it's a little bit different with our nighttime coverage, and then also the on-call members. If they're coming in, do we take the 2 seconds hopefully to take their temperature so we're not infecting a truck? Having to decon that, and then the people that were in the truck get affected as well. So we're kind of trying to work out what we're gonna do with that. Money-wise, we're all right now for overtime and everything. Our overtime is spent, but we have other lines in payroll that we can pull from. And then all the departments have been talking as well, so we reach out for mutual aid if we get affected.
Do you have enough masks, both of you?
No.
No.
So I gave them pretty much one per officer, and as soon as you use it, you lose it, so.
Lose it, yeah. It's gone.
We have 2 to 3 per med bag, we have 7 trucks. We also made kits with gowns, eye protection, surgical masks, and some N95 masks. So we have those as backup, and then we just got I think 25 more today. We have ordered more, but everything's on back order, so. With us, if we have any emergencies, we've been talking to McGregor. They have helmets that they wear and masks with respirators on them. So if it's an emergency that we have to get in, then we'll suit up as well. We're gonna limit our personnel, so we're not gonna be sending everybody in. If we can wait a little bit, then we're gonna send McGregor in, because they have better protection than we do. And then we've reached out to like Kirkwood Corners and other places that if it's something where the person can self-extricate themselves from the house and come outside, we're gonna try and do that. So we're not going into buildings, not affecting the buildings. Kirkwood Corners doing the same thing with the temps. They have no visitors, which was a recommendation from the state. And then if they do have any visitors that have to go in, they're taking their temp and they gotta fill out a survey. But because we're gonna be taking our temps here, we don't need to do that, so it's not gonna delay our response. So we've been in contact with them as well.
And on medical aids, we respond to all the medical aids, but we're responding to assist the fire department. So if they don't have enough personnel to lift assist, we will help. So what we're gonna do from now on is respond, stay outside, if it's not an emergency that we can assist with. And then if the fire department needs us, they'll go in, if not, we're not going in. All our cruisers are assigned to a shift, so there are only 2 officers that drive a cruiser. They have all been instructed at the beginning and end of the shift, wipe the steering wheels down, wipe the keyboards down on the MDTs, the doors, the driver's door, at the end of every shift. I just had Officer Doty and Officer Young went through every car, wiped every square inch of the car down to start them off from square one, and that's about it.
So one of the other things that I learned more about this weekend was who is at risk. And, you know, initially we were all told, quote unquote, old people. If you're over 70, you're at risk. And then that started to come down a little to, well, if you're over 60, you're at risk with an underlying health condition, or people who do have underlying health conditions. Based on the information I saw this morning, that's now 50 years old. And, for example, hypertension will put you at risk, which means I am now in an at-risk category. If you have diabetes, you are at risk. So
Give a bum ticker.
if you have a heart condition, you are definitely at risk. So
And Bill Ruth.
our senior staff, our department heads are all considered at risk. Without delving into the individual circumstances beyond the one I just admitted about myself, we are all at risk. The finance officer is considered a high risk. So we are talking about having her work remotely. The account assistant is high risk. She was working on her last 3 days of employment, as I think you all know. I told her, don't come in. Yeah, so these are, so these are just all part of the consideration that we're dealing with. What I said to my staff this morning is, we're gonna take all the precautions we can. Hopefully it will keep all of us safe and all of our employees safe and the public in Lee safe. And hopefully at the end of it, there will be people who will say, see, we told you it wasn't a big deal, nobody got sick. Well, nobody got sick because we decided to lock everything down and to take this very seriously, so.
So you had mentioned before that you're gonna shut down meetings in this particular building.
I'd like to address that if you wouldn't mind. So by statute, the only meetings that I'm aware that are necessary is the planning board and the zoning board. When they have applications, they have to be heard within 30 days. To the best of my knowledge, the other committees and commissions don't have to meet by statute. So what the advice is for the planning board and the zoning board is if the applicant is agreeable to continue to next month, then that's okay. So the planning board is all set. All the applicants for this week's planning board meeting has agreed to continue to April. As a matter of fact, one of them is Eversource, and Eversource's employees are not allowed to go to any public meetings as of this morning. So that planning board is all set to be continued to April, and I have one zoning board member who I need to get in contact with today to see if he will be amenable to moving until April. And other than that, to the best of my knowledge, committees and commissions are not required to meet monthly, just the planning board and the zoning board.
So do we have to make a motion on that to have no meetings, or how do you
Well,
want to
I
handle
think
it?
at the end of this, it would be good to have the board vote on kind of all of the collective recommendations that we're making. So let's talk about select board meetings. I mean, there are instances, and quite frankly, just from the perspective of select board meetings, thank goodness this didn't happen during budget season, because we would have been required to conduct an awful lot of meetings. There are certainly situations where the select board is required to hold a meeting. For example, if something comes up and requires a public hearing, and like with the planning and zoning board, there are certain times. But you're not actually as required to have meetings, I think, as other, like the planning and zoning board. You can sign the payroll and accounts payable manifest contemporaneously, meaning you don't have to do that in a meeting. Whether the select board continues to meet, obviously, is gonna be entirely up to you. As you know, if you have a public meeting, you have to allow the public meeting to attend. Would we like to think that the public maybe wouldn't attend, knowing that they can read the minutes and see the videotape? Sure. But if you have a public meeting, you can't keep the public out.
I think that it would be good to have set up some kind of conference call periodically. I want to know what's going on as far as, all these things we were doing. What, we can't do a conference call?
Statute does not allow you to conduct the meeting via conference.
Well, I know, I understand.
You
but-
can call
but
individually.
We're reacting now to something that's very abnormal in terms of.
I understand, but we haven't been told yet that we can ignore all of the statutes. Certainly, like we do with some other things. You can call me, or any one of you can call me, or call your other department heads. We can put out,
Pull out a bulletin.
put out a bulletin, put out an email. As you may have seen in Friday's e-crier, it contained a notice, and I believe it's also on the website, where I suggested that people not come in to the public buildings. That they call first or go online first, or call us and we'll walk them through the online systems, because there is an awful lot that can be done without having to come into town hall.
Okay, as long as we set something up where periodically, once a week or every other day or whatever, we get a status of what's happening.
The next meeting, what's happening? What's on the agenda?
I should have written that down before I left. Selection of chair, that's it.
Yeah.
That's on there because of the time of year that we're in.
Town center.
Town center was gonna talk about what are they gonna do, but I mean, obviously, quite frankly, if the select board agrees that committees and commissions are gonna suspend their meetings, then that conversation could also be suspended. I'll certainly check when I get back to town hall and let you know what else was on the board. I don't recall, I don't think any of you had anything?
No.
No.
Could I ask the librarian what's going on at the library, please? Thank you, Ruth. I'll take it over, I'm sorry.
Yeah, you are, I noticed that.
What? Why don't you
You're
have
just,
the,
you're just like.
can you have the vote
10
now?
days
This is a
early.
public meeting, is it not?
It is.
Yeah, we can vote it now, yeah. Please.
I will be, I'm, as Julie is, getting tons of emails, what libraries are doing, and they're wide ranging, from shutting down services completely to partially reducing hours, to offering curbside service. So within the next 48 hours, the trustees board will be meeting and making some decisions. Certainly, when there's no school, we don't have any after-school programs, so that's at least 3 afternoons that there won't be programs. Our daycares had already made the decision they won't be coming out for story time. So at the very least, we'd be not having any of those types of programs during the week. We're getting news from the Portsmouth Library, just announced they're closed to the public as of today. That's a big library, big impact. And there's smaller libraries that are offering, limited service hours, saying you can come between this period and that period. But quite honestly, if you really want people to stop coming out in contact with others, even a limited hour says, okay, everyone crams into the library through these 2 hours, like, that's worse risk than spreading them out. So we've got lots and lots of information. We've got, we will be writing our pandemic policy, and there's the several libraries that have graciously offered to let us adapt and adopt their policies, so we won't be reinventing the wheel. But that will happen. We do have, right now, a meeting with the trustees on Wednesday evening, and might try and push that forward. So, as I left this morning, we had a family just drop in. They were walking through the trails and said, let's stop and see if you're open, and we had the door unlocked, so I left Michelle holding down the fort, so. And we'll certainly inform you when we know the definitive answer.
Thank you. Linda? I'm going through one by one.
Yeah. Actually, I do have a lot of, in regards to vehicles, renewals can be done online, but new vehicles, they have to come into the office, so I'm at the mercy of what the state decides, and I don't know whether you've heard anything, whether they're gonna have any discussion or anything.
I think they're gonna have a discussion. Because all the municipal managers are asking for those conversations to take place.
State of Connecticut's already done it. Extended expiration dates on licenses and registrations.
Wasn't that, didn't Massachusetts too, or no?
I haven't heard the Mass, I know we just got notice that Connecticut did.
Mass closed the bars,
Mass what?
closed their bars.
And restaurants.
And restaurants.
And restaurants.
Bars and restaurants.
Ireland for St. Patrick's Day closed their bars
Oh,
and
man.
restaurants.
Oh, my gosh.
Illinois isn't
That's
closing,
serious.
Illinois isn't closing their bars until after March 17th. As far as taxes, this is the leaning and deeding time and process. I am still going through with, because I have to, I'm going by the RSAs, and there are time limits as to when I'm supposed to be doing notices, so I am going through that because the leaning is April 29th, and deeding, I believe, is May 6th, I think. So I'm going to go, I'm still going to continue the noticing and everything to business as usual on that. So, like I said, my reasoning is, in the office, is I'm waiting to see what the state says that we're supposed to do as far as vehicles.
Public Works?
And dog registration's late, that's okay.
Dog registrations, yeah.
That's okay if they're late. Well, they're not due until April 30th anyway.
All right, so the transfer station, my plan was to try to limit worker contact with the public, was to pull the person off the wall and have them walk the bottom of the wall, not the top, to avoid the contact with people's trash. And then the other one was to stop taking bulky fees out back for a little while. Either let the people drop the stuff off and not charge for it, or just not take bulky items at all, because the people that are back there doing that are obviously helping people take everything out of the car and all that stuff, and then exchanging money, and they're in close contact. That was the transfer station. The highway department, we can do our daily business without really coming in contact with a lot of people and avoid. I mean, down there, if we're out on the road doing stuff, we hardly come in contact with people at all. But I'm also only got 3 people down there, and it's winter time, so if one of them gets sick and it snows still, because it still can happen, believe it or not, we'll just do the best we can, do what we can do, and just expect it to take a little bit longer than normal. Because I'm maybe 35, but I'm high risk for this too, because I've got lung issues from breathing something in that I shouldn't have breathed in with cutting metal and welding, so.
The swap shop's closed?
Yeah, in the swap shop, texted me this morning asking about if they should close or not, and I just said, it's fine with me if you close, and I just used the school date, how long the schools are closed for, to keep that closed for. If it goes longer, then they keep it closed longer. If the schools decide to come back sooner for some reason, they can open it sooner. But that was, they reached out to close that was not me closing that. And I have numbers here, if you decide to just let people drop bulky items off and not pay for it, in April of 2019, that was $3,300. In March, it was $2,000, so those would be about the numbers. Or if you just stop taking bulky fees altogether and they don't drop them off, I mean, you're just gonna drop it off later date. But that's up to you guys to decide how you wanna go forward with that part.
We also got a call this morning from the Oyster River Youth Association asking whether there had been any talk of closing the fields. So in other words, Oyster River Youth Association obviously is gonna make whatever decision they're gonna make about their programs, but are we considering telling them they can't use our fields? So I'm just bringing that up as yet another question that's been brought out.
Well, obviously, if the school is shutting down and kids are going home, why put them together in the field? So I probably would close it down.
You can sit there.
But they might wanna go to the park for something to do, Little River Park, to
Exactly.
play in the playground and things like that, while they're
Well,
home.
yeah, I mean, that's,
That's different than the
Right,
specialized sports.
which they tell you to go outside and get some
right.
fresh air.
One is telling Oyster River Youth Association, correct.
Organized.
We are not going to let you use our fields and
Organized.
facilities for organized sports.
But if
You're absolutely right. It is good to be in the sunshine. Viruses don't like sunshine, so it is good for everybody to get outside
So we
as
don't
much
wanna
as possible.
necessarily close.
Right, so we may not want to, and I'm not sure how the heck we would police it anyway.
Correct.
I mean, let's not overtax
Our existing.
our police department. By now, they gotta be the playground police. I mean, people are gonna have to exercise whatever common sense that they are gonna exercise for themselves and for their families.
ORY did send out an email saying that they're suspending all activities until March 27th.
That's like since
And
9 o'clock this morning. Wow.
and then they're gonna reevaluate them after March 27th.
Problem solved.
The problem's solved, thank you.
Can I just make a statement about like all this stuff?
Hmm.
So, the biggest concern, and I know we keep talking about like social distancing and all that, and people contact, it is a very contagious virus, but the biggest thing is the ERs in the hospitals. We don't wanna keep spreading it around because they're getting so many patients, and that's why everybody's saying call your doctor, because if you have mild symptoms, you just stay home. There is the percentage of people that are gonna need the ICU and the ER because of the outcome, because of their age, their conditions. So if all of us, just like the food in the grocery store, if all of us just keep going there, it's gonna overwork the system. So they're trying to flatten out the curve that we talked about this morning. Instead of having a high peak at these ERs, we can slow it down and just spread out people getting it. So it's a lot easier for the hospitals.
Whether 1,000 people get it in this amount of time, or they get it in this amount of time.
It's better in that amount of time.
Yeah, one of the things, and I'm a little muddled this morning, sorry, in terms of processing information and who I've sent information to. I think I sent the board a couple of the emails that I already
You did.
received. Well, I can't remember again whether I sent my niece's email.
No, I didn't see
Okay.
that.
I did send it to the department heads, I did read it to my staff. That was chilling. Now, I understand this is Lee, New Hampshire, this is not New York City. But we are about 10 days behind Italy. And Italy is really wishing right now that they had locked down sooner, because for exactly the reason that Chief Nemeth said, the problem isn't that we're all gonna get sick, it's that we're all gonna get sick at once. And there are only, one thing I read, 45,000 ICU beds in the entire country. And this disease could easily create a need for 200,000 or more ICU beds. So you can obviously see if that happens all at once. Just like, simple analogy, I saw somebody put that on Facebook, picture what you saw at Market Basket. Picture what you saw at Market Basket and then translate that to our hospitals. They don't have enough respirators. They are already in New York City triaging sick people, meaning you get a respirator and you don't. So, again, I understand, Lee is not New York City, but we still have to do everything we can to flatten the curve.
And we did double over the weekend,
Yeah?
so.
So my thoughts on this, just my thoughts, we'll see what the other two select people think, is that we postpone all meetings that are not required by law until further notice of the board. I'll leave it as further notice, I don't want to put a date certain at this point. So that would include everything except for the planning board and zoning board. I'll leave it to the zoning board director and so forth to decide if meetings need to occur or not. Second, as part of that as well, is that all department heads and directors, obviously as presented today, will just follow their particular requirements and dictates. I don't want to micromanage, no matter whether it's library or police or fire or highway or, tax collecting and so forth. Last part of this, I'll ask the town administrator to check in if we can use unassigned fund balance. I know we talked about budgets available now, but what if it continues? The budgets will go, and what will be included in that is how do we deal with issues of people that want to stay home and they paid hourly, and how do we handle those type of things? We might have to find a new way to fund that as much as possible. So that was my thought at this point.
I mean, what we haven't talked about is our worst-case scenario, which is where we all get sick, or department head staff, or a majority of your staff get sick. And to a certain extent, I don't know that we can plan for that. I mean, people still have to get paid, so somehow, and for reasons in town hall anyway, we've been talking a lot about cross-training and remote
Exactly.
doing this and how we're gonna do this. So we have already gotten some plans in place for how we're gonna do this, and I think we all just have to keep on top of that and try to think about that. And for us, it's gonna be thinking outside the box, because we're small, there's not a lot of us anyway. So, it may be all hands on deck. I don't know. I don't know what I don't know what I could do to help you if all of your police officers have to be out. But I'm just saying, I think we're all, in the past, have been very good about pitching in. I mean, God forbid, Karen, you get sick, I don't know, on the phone, tell me what I have to do. So I think we're all just gonna have to be,
I think we all work together well
Right,
enough. I
right.
mean, obviously, we can't fight a fire or be a policeman, but as far as
Right,
office things, you can help me, I can help you.
That's
we can
where our
help
mutual aid
Linda.
comes in. We
Right,
reach
right.
out to our mutual aid
Right.
partners to help each other, so.
right. So, you know, it's a very fluid situation.
I think also we need to consider the other resources that we're not gonna have. I mean, part of the problem with some of the shortages we have at Market Basket is not that there's none available, it's that they can't get it to market, okay? That same thing is true for the banks in cash, so we might wanna look at our cash on hand to see what we have to keep going, because I can anticipate, I was listening to a program this morning where, you know, banks don't open. And you're not gonna be able to move any money around, so we ought to look hard at how much cash on hand we have or should have, can have.
My daughter works for TD Bank in Portsmouth on Route 1, and as of close of business on Saturday, they were almost out of money
Yeah,
because people were coming in and withdrawing. One gentleman came in, withdrew $15,000, and she had a bag, he said, nope, stuffed it in his pockets, and out the door he went.
yeah.
So
We need
it
to-
is a
we need to
real
look hard at
problem.
that, so we can keep some emergency operating cash on hand.
And by cash, you mean what we have liquid available in the bank, because we
Yes.
obviously cannot, we're not a cash-based,
That's right.
No, I understand,
Yeah.
the question is, what do we have that we have
Right,
access
right.
to that we can process?
Chiefs, how do you know who's quarantined and who's not? So for instance, you get a call to go to 123 Main Street or Mass Road. How do you know there's not somebody there that's already been self-quarantined? Is there a list or anything?
So
How do you guys know that?
we don't have any lists.
Yeah.
The state of New Hampshire sent out to E911 all these questions that the dispatch is supposed to ask. So they've upped their level at
Okay.
E911, so by the time it gets to us, then we should have that information.
Okay.
But yes, for our members, I sent out a general order, so when the members go into the house, they're supposed to stay 6 feet away, talk to the person, try and figure out their symptoms,
Okay,
put on a surgical mask if they need to, or N95 mask.
okay, all right, thank
We
you.
do the same thing.
That's
Should
it.
be worried about the cough or
Yeah, I'm gonna take them all back. It'll be all right.
really put them out? Okay, all right.
I'm good.
You gotta put them in a plastic bag, is that?
Yeah.
hazmat suit. Sorry again, don't mean to sound like a broken record. Still gathering, we're all still gathering a lot of information, still an awful lot of questions. I'll certainly continue to forward information to the select board as I get it. Again, with the, how do we treat an employee? Let's suppose we know that an employee goes to a gathering with more than 50 people
They should
in
know
a,
better.
in a city, I don't know. And
You should
do
know
we,
better.
can we tell them not to come back to work? I mean, we're so, I don't wanna say we're short-staffed. We are not short-staffed right now, except that we are always short-staffed. You know, we have
We've been
one
lean for
person that
years,
does this and one person that does that. So we're gonna be in this bad situation where we wanna keep everybody safe, and yet, what do we do if, you know, we kinda can't operate shorthanded for a month.
The other thing, you've got two different classes of people here. You've got
Mhm.
people that we pay on a regular basis.
Right.
We've got people that we pay on a,
Don't touch your face.
no, I'm tearing because I'm so upset. People we pay on a regular basis, but then we got people on an hourly basis. So if we tell somebody that they're an hourly employee, you need to stay home, that puts a financial burden on those particular
Absolutely.
people. So how do we deal with those particular things? Same thing in terms of the real world out there in terms of restaurants. People who paid an hourly basis for servers, they're closing the restaurants. What do those people do for money?
I know.
So, you know, the people that we have that are benefited, they can take sick time, vacation time, whatever, but those other people, specifically in the fire department that we pay on an hourly basis, some of them have other real jobs, but those are, that's a concern for me in terms of how we support those people, because, you know, if you don't get any money, you can't do too much, so. it's a
And that's what we
concern.
discussed, outside of our 32-hour week, all of our employees have,
Right.
you know, upwards of 640 hours of sick time.
Mhm.
I look at this as an illness, and that's what I told John Brooks when he called me Saturday. I said, stay home. He goes, well, how am I gonna get paid? I said, sick time. It's an illness, so you put in for sick time, and we'll deal with it from there.
It's only when the sick time runs out that.
Right, and I mean,
But this also you can use it for short-term disability.
well, that's what's gonna happen after, what was it, 2 weeks?
No, it's a week,
A week?
8 days.
8 days. Short-term disability kicks in anyway, so,
Yeah.
you know, they've got, and unless it's in extreme circumstances, most likely 2 weeks, the 14 days, they're gonna be able to come back.
Yeah.
So.
Unless they get exposed again.
Unless they get exposed again, correct.
Which is a separate strain.
Right,
There's two strains out
two
there.
strains.
Right.
How is the law that they're passing affect municipalities? The one that says that small companies under X amount
Right.
have to pay 2 weeks
Right.
at 100%, and
One thing that I read said that it did cover government employees, but I think it excludes
I agree.
first responders, so, yeah, it's just another one of those things that we're just gonna have to try to figure
Yeah.
out.
There was a city councilor in Florida, Miami, who actually brought up during an emergency meeting that he was told by a physician that once a person gets COVID-19, they are then immune to it. And he suggested that first responders volunteer to be injected with COVID-19 to, quote, take one for the team, so that then they could still continue to work because they're now immune from it.
Wow.
Yeah.
But it's two different strains.
And what was the response to that?
Yeah, it wasn't good. Like Julie said, is he locked up in the loony bin right now? Yeah, it wasn't well received.
No, I didn't think it would be.
But,
The other thing we talked, and I think you guys were just talking about it, I think we have to revisit this, possibly weekly,
Yes.
because it could get better,
Right.
could get worse.
Right.
so that's what
I
I was
think
just
we need
thinking,
to-
sitting here, you know, we're talking about it, how it's fluid and ever changing. If the number now doubles again by the end of the week, we're gonna have a whole different conversation.
Absolutely.
God forbid we start having people from our town, we're gonna have another conversation. So, yeah, I agree.
So we at that position then?
Well, I'm not in favor of closing Little River Park or any of those things. I'm okay if we close it to organized events, which it sounds like
It sounds like
they've
we've done
already taken
already.
care of that, so.
But I think we should doubly enforce that so we can keep it under control. So I'll make it into a formal motion, and you can add to it. So number one, the motion is to postpone any boards, committees, or commissions into further notice. Also, to postpone the use of Little River Park or playing fields that are associated with organized sports. Also, obviously, as I said before, department heads and directors make their own decisions at this point how to handle this particular situation. Also, that we somehow meet on a weekly basis so we can stay updated. Also, as Selectman Brown suggested, we should put this in e-crier, updating regularly what's happening, so everybody's in tune with what's going on. And of course, you'll check in the unassigned fund balance if we can tap into that if we.
Linda,
I'm just wondering, in that, are you going to formally request, or can you formally request, that the public not come to our visit unless absolutely necessary? I mean, so if there's just questions they wanna ask or something like
Yes.
that, they don't have, so that's what I just make, I
That
don't
would
think
be
you make a
inclusive.
formal request that they don't come for just, piddly things.
Well, there's a difference between requesting and you are shutting the building down to the public.
So can I like lock my office, put a box out front, if you're getting a building permit application, put it in a box, and I'll go grab it from the box at a later date, is that acceptable?
Yes.
Okay, thank you.
so let's
Dave, you
clarify
had something?
what that means to people.
Right.
though.
Mhm.
Yeah, I just wanna know, you said the department heads can do what they think best, but what do you wanna do with the bulky fee? Suspend it?
Suspended,
Okay,
suspended.
all right.
Yeah, just let them dump it.
That's all I wanna know.
Really?
We're all
What
suffering.
does that mean then, suspended? Suspended to me means you're not accepting any bulky fees. I'd rather not accept them for a period of time, because that's gonna cost us money.
You mean not accept the bulky?
Not accept
Yes,
the
not
bulk.
accept them.
That's what I mean,
So,
Yeah, so no bulky fee,
Yeah,
no,
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 bulky,
no,
no, no exception of any bulky fees.
Yes.
yes.
That's
Yes.
correct.
That's what I wanna know, all right.
And if it progresses longer, then let's consider just taking them and just being done with it. So,
Okay,
see, this is what I mean by we need to be understanding. What you said meant something different to me.
I got it, absolutely.
So-
And that's why it all goes into e-choir, so everybody understands it.
all right.
So
We actually,
we're-
sorry, not to be all procedural, we should have gotten a second to be.
Right.
Are we still developing the motion
Well,
though?
yeah, okay.
We're still kind
Yeah.
of, because
Yeah.
they need to be
Yeah.
understanding what we're saying, and also we need to be understanding what we're saying, because we need to be all
We
on
need
the
to know
same
what we're
page.
saying, what we're saying.
Yeah.
And what we forgot to mention was we're going to do a public announcement this afternoon. Julie's gonna draft up something that we're gonna put on all of our Facebook pages, e-crier, and the website, just to address, because there's a lot of concern on Facebook about what's going on. Hopefully
Can
we'll
somebody
squash that.
ask Laura Thompson to put it on Neighborly too?
Yes, we can post it on Neighborly.
Okay.
She picks everything up anyway, but
I
yeah.
just want to
But
be,
we can post it on Neighborly, and then I'm on the COVID-19 special page,
okay.
and then the police department, fire department, and EOC will post on our pages as well.
Okay.
So do I hear a second?
Well,
Sorry, yeah.
I'd like us to finalize some of these things. So can we at least put in what the chief said and what Linda said in terms of, because they get exposed to the public more than anybody else. So just be clear in terms of what the police department is expecting, what the fire department is expecting, and what Linda's expecting.
Well, I
And
guess-
your office as well.
Right,
So-
that's what my question is, are we just, because we've already suggested that people not come in, but are we locking the door?
Well, that, we can't, but you can.
Right,
I
Yeah.
can, John said I could.
Right.
right,
I mean, we can't, because obviously if somebody comes in with an emergency, they've
Right.
got
And at the moment,
I mean, we
can't
can
either.
limit it, so we actually technically can lock the door because we have the call box.
mhm,
Sign says the doors are locked, use the call box if Robin's not in. They can call in and we can screen through dispatch what it is they need.
right.
So that might not be a bad idea. We don't have them in the hallway, they're still outside, then we decide. So, yeah,
So the 91A statute, to get the technical, the 91A statute says that the public has a right to come in and inspect public documents during normal business hours. If the select board determines that because we are in an emergency situation, we don't have office hours, I'm kind of thinking that
Right.
that covers us. Again, people can call us up, we'll go look at the records, I mean, we're gonna do everything we can email stuff. I agree, Linda, right now, so far as we know, you have to keep accepting new
Right.
vehicle registrations.
but it's gonna limit the exposure.
Right, right, right.
Which is the whole point of doing this, is to
Right.
limit it, spread it out.
That's great.
And we've got that conference call in 10 minutes.
Right.
So are we all clear?
Yes, I think so.
So can you read it back or?
Well, motion to postpone all meetings, all committee, board, committee, and commission meetings until further notice, except those that are statutorily required. Little River Park will be closed to organized sports. Department heads will handle, I don't know how you exactly put this, handle their own operations. And that the select board wants to continue to have weekly meetings. And that we will request that the public only come into the town clerk tax collector's office for new motor vehicle registrations, but that the selectman's office will be closed to the public.
And the planning board.
And the planning and zoning office until further notice.
Clarification, you said committees and commissions.
Boards,
There's
committees.
other groups that use these facilities
Yeah,
besides, so.
yes,
So.
all
can-
outside.
Heading
Oh,
outside.
Yes,
Right.
so
Yeah.
let's include that in there too,
Yeah.
so, just so we're clear.
We've already had questions
Yeah, well,
from outside groups saying, are we gonna be canceled? So, we've been holding them off until after this meeting.
okay. Are we
So-
good?
And also, depending on what the state says, right now, renewals, car renewals, they could hold off, but towards the end of the month, if the state hasn't said anything, people are gonna have to come in, so I can't restrict it to
I
Do
think
just.
they have
that's,
to
I think
come
they're
in?
discussing that today.
Do they have to come in for renewals?
What's the cost?
They can do it online
Yeah,
if
they
they
cost
aren't
more.
2 months late, and, but if they've just moved to town, they cannot do it online,
Well, I consider that a new registration.
Yeah.
I mean,
so.
but they can drop, so for example, if they do it online, there's a fee, right?
Yeah, they could put it in the box.
They can put it in the box.
They can put it in our box and we can mail it to them. But yeah, there are exceptions, like everything, there's exceptions.
Just about
to all
everything can be
rules.
done online, like for us, for pistol permits, requests for reports, house check requests, anything like that can be done online.
Certain permits you can do online now.
We're still gonna do inspections. Like Bill, my employee's out sick for a few days, but I'll cover those inspections. So we'll still do the outside inspections, it's just in-office visits that we wanna
Exactly.
get rid of.
Okay. Okay. Second.
Thank you. Any further discussion? All those in favor, please say aye.
Aye.
Motion carries. To clear up some of these issues, I'm nominating myself as chairman of the Board of Selectmen. Do I hear a second?
Oh, I don't know.
That was already done, John, I don't know why we have to discuss it now.
Second.
Thank you. Further discussion? Hearing none, all in favor, please say aye.
Aye.
Aye, thank you. Only slightly arrogant, but life goes through. I don't want to leave us disbanded without a chairperson.
So John, there's no planning board meeting this week.
I understand, thank you very much.
You'll get an email.
Linda, you still open, because I'm registering my truck today. Thank you. I was gonna say until the end of the day, so I can get them.
So obviously, our next regularly scheduled select board meeting is next Monday, the 23rd.
That'll be, well, it might be canceled if there's nothing happening.
Okay, so I'll just be in touch.
Be in touch.
Okay, but then you said you wanted to meet weekly.
What we meant is,
If it
again, is
changes.
interpretiveness. If something that's important that we have to discuss, we can discuss it through you,
Yeah,
okay?
yep.
And my request would be, if there's something that comes up, just communicate with us
Thank you.
individually,
Right,
and if we need to meet, we need to meet.
We need to meet. If it's something that we have to make a phone call
Okay.
on.
okay.
If it's just information transfer.
And we're going to publish something through,
Yes.
to the
Yep.
town of Lee, if you would.
In all of our
Through
respective
Facebook,
Facebook
it
The
pages.
more education out there, the better off.
Yeah.
we're gonna be.
We can do an e-crier blast too, right, Julie?
Yep. Okay.
Thank you, gentlemen.
Move to adjourn.
Second. Thank you all for coming.